So as we get older, we get various changes in the layers of the face, which we recognise as those changes due to ageing. When we're born, we have the skull, we have the facial skeleton and facial bones. Overlying that, we have various layers. We have a layer of muscle, which pulls on the overlying skin, allowing expression and emotion. We have a layer of fat, which provides cushioning for the skin and support for the skin, particularly with fat pads that sit in the upper cheeks and the temporal areas. Overlying that, we have the skin itself, which also has various layers, but has two main protein fibres which sit in the skin, which are important when we think about aesthetics. One of those fibres is known as elastin, which gives the skin stretchy, elastic quality, as the name suggests. And the other fibre within the skin, which we've all heard of, is collagen. And that allows the skin to be tight onto the underlying tissues, but at the same time allows it to move and glide over their fat pads and muscles and gives suppleness to the tissues. As we get older, we get changes in all of those layers. Some of the first changes we get are due to those protein fibres within the skin. So the elastin gives the skin stretchy, elastic quality. Now when we move our upper face particularly, raising our eyebrows, frowning and smiling, we get the same lines and wrinkles at any age, even in teenagers for example. But when teenagers relax their faces, those lines disappear, and that's due to plenty of elastin in the skin. As we get older, the fibres within the tissues begin to reduce. We have stem cells in our skin called fibroblasts, and these are the cells that produce collagen and elastin. As we get older, the fibroblasts begin to deteriorate, and they don't produce elastin and collagen at the same rate. However, the skin is always removing old collagen and elastin fibres for them to be replaced. So overall, as we get older, we have significantly lower levels of elastin and collagen. Due to those lower elastin levels, when we raise our eyebrows, frown, smile, those lines due to expression and emotion, because there's no elastin there to allow the skin to bounce back to its normal position as we get older, those lines then begin to be noticeable at rest. And they become those lines that we classically associate with age. What we can do for those sort of lines, which we call dynamic wrinkles, those that are there with movement, is we can weaken the underlying muscle which pulls on the skin, and those lines can appear reduced and relaxed. That would be anti-wrinkle injections with botulinum toxin. In the lower face, however, so it's not generally the changes are due to muscle movement, but more to do with the loss of fat and collagen within the skin. As the fatty layer thins and the fat pads descend as we get older, the collagen reduces in amount and therefore is not pulling the skin tightly against the tissues anymore. Essentially, the skin, which stays of course the same size, becomes too baggy for the facial skeleton and drops with gravity. These are what we call static wrinkles in the face. So classically, the lines between the nose and the corner of the lips, which we call the nasolabial folds, lines between the corner of the lips and the chin, that we call marionette lines or labiomental folds, and at extremes, hollowing of the cheeks and jowling effect of the face. Now, because that's not due to muscle movement, things like botulinum toxin and anti-wrinkle injections won't be very effective. But what will be effective is by lifting the face back to where it once was. And we all tend to do this in the mirror, lifting the tissues up, lifting that saggy skin to where it used to be. Now, traditionally the way to improve that would be with surgical facelift, to literally tighten the skin back onto those underlying tissues. But over the last number of years, we're now able to do non-surgical facelifts, which is to reconstruct that fatty layer under the skin by placing filler in specific anatomical points to have that same effect of lifting the tissues. So as we described earlier, we get changes to the face due to loss of elastin, loss of collagen, and loss of the fatty layer under the skin. So traditionally, when people look in the mirror as they get older, we all tend to do this. So to tighten up the skin, lift the face, and see what it used to look like when we were younger. Now, a facelift essentially aims to do exactly that. It tightens the skin onto the underlying tissues and lifts the skin back to its pre-anatomical position. Traditionally, this could be done with surgery, with a surgical facelift. However, what we can do, and what we have been able to do for some time now, are non-surgical facelifts. Now, these have a big advantage over surgical facelifts, is they have much significantly less invasive. They have significantly reduced risks and complications as opposed to surgical treatment. And actually, with new technology now, newer procedures and newer products, they can actually last a significant length of time. So traditionally a surgical facelift has risks and complications, and the main ones of course are the fact it's generally done under a general anaesthetic, which means you have to be in hospital. Although it is often done as a day case procedure to go home the same day, it can sometimes be quite extensive, and with complications patients may need to stay in hospital for longer. It involves a general anaesthetic, which has risks of its own, and it has risks associated with bleeding, infection, damage to the nerves under the skin, problems with the blood vessels, and of course the fact that the skin itself may not necessarily take to the facelift quite so well. One of the advantages of a non-surgical facelift is it almost removes all of those potential risks and complications. It's still a medical procedure, so there are still risks associated with problems with infection, bleeding at the injection sites, bruising for example. You can very rarely have problems with the blood supply to the skin or deep-seated infection, but these are extremely rare, particularly when compared to surgical facelift. The way we do a non-surgical facelift, and the reason we tend to treat patients with non-surgical facelifts in the first instance, is due to that loss of collagen and the loss of the fatty layer under the skin. So unlike the loss of elastin and those movements that we get in the upper face, which predominantly would be treated with anti-wrinkle injections to weaken the muscle, the lower face can't be treated with anti-wrinkle injections, and that needs to be treated with filler. We would generally tend to use hyaluronic acid, which is a normal substance found within the skin and the tissues of the body, and by adding in extra hyaluronic acid, we can plump out and lift the underlying tissues and essentially anatomically reconstruct that fatty layer that once existed in the lower face. So generally speaking, a non-surgical facelift involves injecting filler into specific anatomical points around the face to lift the tissues to where they once were and reconstruct that fatty layer or those particular fat pads in the upper cheeks in patients who have got significant fat loss and reduction of collagen, which happens to us all as we get older. So generally speaking, anybody who is considering treatment for aesthetics or for rejuvenation needs to have a consultation with a qualified practitioner. What we would do at that situation is we would assess the face to see whether a non-surgical facelift would be appropriate for each individual. Now, everybody ages differently, and some people, of course, don't require any intervention because they've still got plenty of collagen within the skin, they've still got good skin quality and good support for the tissues. However, some patients will find that they lose collagen at a more accelerated rate. For example, smokers, people who are generally dehydrated and don't drink enough water, and those that use sunbeds or lots of excess sun exposure. All of those are risk factors for aging, as they reduce the amount of collagen and elastin we have in the skin much more rapidly than general aging. But of course, genetics will also have an effect. So when we're assessing a patient for a non-surgical facelift, what we look at are those changes that I described in the face due to loss of fat, movement of the fat pads in the face, and the change to the overlying skin. We will then look at whether or not patients need majoritively upper face treated, so particularly the upper cheeks, or whether the main problem is in the lower face. And then by placing filler in specific anatomical positions around the face, we can create an effect to tighten the skin and lift it back to where it once was. So for a non-surgical facelift, it involves injecting a filler substance into the tissues, and usually quite deep under the tissues to help to reconstruct the fat pads and to lift the skin. Now the filler we tend to use is hyaluronic acid. Now we have hyaluronic acid already in our tissues, so it's the sort of substance that is already present in the skin, gives the skin hydration and binds the skin cells together. However, any injection of any substance in the tissues can potentially cause allergic reactions. It can cause swelling and inflammation, and very rarely can cause problems with infection. It's an injectable treatment, so of course by putting a needle into the skin will inevitably cause a small amount of bleeding. So it's quite common to get little pinprick bleeding points, which usually settle within a few minutes. But also, of course, there's a possibility of bruising. Now, bruising to the face is often quite noticeable, so you need to be aware of the fact there is that small downside. It's a very low risk, and most patients don't bruise, or if they do, it's very mild, and of course it can be covered up with camouflage makeup and foundation. However, though the main risk that you need to be aware of is bruising, swelling, and a small chance of infection. One of the risks of injecting fillers into the wrong position is it can cause occlusion of blood vessels or damage to nerves, which is why when you're selecting a practitioner to perform the non-surgical facelift, it's extremely important you have someone who is appropriately qualified and experienced in the procedure, because inadvertent injection into blood vessels, or particularly into nerves, can cause problems with the nerve supply and the blood supply to the skin, and at worst it can cause damage to the skin, loss of blood supply, which can result in quite significant deformity. But thankfully that is quite a rare complication, and in experienced hands most patients get a fantastic result. With surgical facelifts there is a bit of a downtime, so it might take a few weeks for you to notice the final results. One of the big advantages of a non-surgical facelift is an immediate result that you can see before your very eyes. As the filler is injected into the tissues, the expansion and the volumization that it creates can be seen immediately in the mirror, almost immediately after the injection has taken place. What we tend to therefore do is plan a patient's treatment, depending on a number of different factors. Patients may only require a subtle change, particularly younger patients, whereas older patients might require more of a dramatic result. One of the benefits of non-surgical treatment is that it can be staged. Patients can come and have 1, 2, 3 or 4 vials of filler in one sitting, and then return a number of weeks later to have further filler placed in the same positions. What happens in that respect is that we get that immediate initial result. The patient is allowed time to get used to their new face and the new appearance. But then of course we can always add to that. I personally aim to go for subtlety, to give a natural result, but of course some patients would want more of a dramatic change, which we can achieve by placing more fillers into those anatomical positions. Generally speaking, most people will need fillers into 8 positions around the face on both sides. Some less, some more. So the main take-home message is that everybody is treated as an individual. The treatment is tailored to their own facial anatomy and facial skeleton and the changes that they present with. But the ultimate aim is to give you a long-lasting result with minimal downtime, low complication risk and safety.